everybody, I'm Dr. Laina.
And I'm Dr. Jamie.
And today we're going to talk to you about how you can use a lacrosse ball or a tennis ball or our favorite, which is this acuball, in order to get rid of some of the trigger points and tension that are caused from sciatica and other low back pain issues, even sitting too much. So an acuball, we'll link it below so you can see what, you can research it a bit yourself on Amazon. They're not very expensive. They're our favorite thing for massaging, for getting rid of trigger points, because you can heat them up and they have all these little spikies which actually feel pretty comfortable, and they have just the right amount of give. But if you want to try it with your lacrosse ball, you can do that too.
You've even traveled with it.
I always travel with it. Yeah, I have a couple.
Takes a little explaining at the airport.
Yeah, we always get pulled over when we go through customs because I take it on the airplane with me, which I'll explain in a minute. They come in all these different sizes. My personal opinion is that you only need this one big one to start. You can do pretty well everything with that one. So we're going to show you how you can use these acuballs or your lacrosse ball to get rid of some of your trigger points. So first and foremost, just so we can orient where we're going to be putting the lacrosse or the acuball, is I just wanted to show you something on the pelvis. So a lot of sciatic pain is caused by things being out of alignment in through this area. So that you can orient yourself, this of course is the back of your body, and these things right here, they call them your ASISs, are those bumps that you can feel. You know, there's two bumps right through here, in through the back of your pelvis. So that's what these are here. And one of the reasons that I'm showing you this is we want to make sure that we're not taking the acuball or lacrosse ball and putting it on the joint itself. If that's going to feel a little bit like you've hit the right spot, because it's going to be tender, but it's really just inflamed. And if you take a lacrosse or an acuball, which lots of our patients have tried to do, and then you put a lot of pressure in through that area, you're going to notice that later on it's going to be much more sore.
You just make it worse.
You're going to make it worse. So what we really want to do is we want to focus on the muscles around this sacroiliac joint and through the low back. So the first muscle that we're going to be focusing on is actually just to the right of that bump. So it's right in through this area. It tends to get very sore. It's one of your smaller glute muscles. It tends to get very, very sore when this muscle, when this joint is out of alignment and the nerve's being pinched, because it's trying to stabilize things. Then we're going to show you how to use it for your piriformis, which is sort of out here, more in the butt cheek. A lot of people are very familiar with that muscle. And then we're going to show you how to use it for your hamstring, because a lot of people don't realize that your hamstring attaches on to the bones of this joint as well. So if you've got a tight hamstring that's pulling, that's really going to make things much worse. It's really going to bother you if you're sitting too much. And in fact, a lot of people who think they have sciatica actually have hamstring tension that's pulling down the back of their leg, and that's what's causing them the pain. So we'll show you how to find all of those. So we're going to start off by doing the first two on your back, because that's the easiest way to do it. The hamstring will demonstrate that sitting. So I'm going to have Dr. Jamie lie on his back.
On my back.
The whole idea with this is that you want to stay very, very relaxed. You're just going to let your body weight do the work for you. There's not going to be any ramming into the ball or anything like that. There, you do run the risk if you push too hard that you're just going to aggravate the area. So go really, really slow. If you choose to heat up your acuball, you can only do that if you have a microwave, is my understanding. So you're going to put it in the microwave for about a minute. When you first take it out, it might not be warm. Don't put it back in. Just give the heat a chance to reach the surface, because it heats from the inside out. If you re-nuke it, I guess you can explode and melt these things. So we're going to start off with Dr. Jamie finding that area. We talked about that ASIS just beside it and down. So it's right in through this area. So my ASIS is right here, and I'm going just to about an inch outside to the outside and about an inch down. So if you could put that on your glute med. So he's going to do that with his knees bent. And he's going to know when it's there, because if you stick your thumb right into that muscle, you're going to know that it's there. So you're not on the inside of that bump again, you're on the outside. So I'm sure you can feel that. Yeah. So you can just lie here and let gentle pressure do its work. You want to lie here for up to 3 minutes. The first minute's going to be the most painful. Then you should start to find your body melting into it. If he wants to increase the stretch, he can let this knee fall. Nope. Not that way. He's going to let the knee fall. Nope, keep this knee straight. Just let the knee fall where the ball is, to the outside. So one knee stays up and the other ball falls to the outside. You can see how that'll deepen the stretch right in through that area. And then after he's done about 3 minutes there, he can take the ball out and move it to your piriformis, which is a little more right in the middle of the butt and upwards. You're gonna find that sweet spot because if you can even move your butt around and just roll it around till you find your piriformis. You'll know right away because it'll feel like you're hitting almost like you're hitting a bruise. And again, he can lie here just like this. He can move his buttocks around a little if he wants to, and he can let that leg fall out if he wants to as well. Okay, just hanging out.
Feels really good that way.
That's good.
Just so you know.
Okay. Now we're going to show you how to do some of these sitting up. The hamstring is quite hard to do lying down like this. So first I'll have you just sitting up. So the hamstring insertion is one of those places that a lot of people don't realize how deep it is. So the hamstring insertion is deep under the butt. So it's right on the bottom of the butt. So my hamstring insertion is very deep in through this area. So a lot of people have a deep, deep ache in through there, and that's where their hamstring is pulling and pulling. So if you're doing this sitting up, he could be sitting against the wall as well. He's just gonna put that as deep into under his butt as he can. So right where your leg meets your butt. Yeah, it's a little tight, isn't it? And just try to get some massaging that way. He can also move it down through the hamstring if he feels the tension more in the muscle belly. He can move himself back and around. He can take it all the way down his hamstring as well and play with different areas until he finds those muscle knots in those sweet spot. I'm not going to recommend you put this on the back of your knee at the other end of the hamstring because you can really aggravate the ligaments in that area by doing so. Okay, so that's how you would do this. If you were going to do it more on the floor or on a bed, although it's kind of hard to do on a bed because it's soft, you do need to be on a firmer surface.
Yeah, I think this is a bit soft.
This is a bit soft. So you can also use this in a chair. So the reason that can you just turn around me? So the reason that I travel with one of these everywhere he goes because of my scoliosis, if I'm sitting in one spot for too long and I can't get up and move around, certain muscles will start to tense up, but that happens to a lot of people who sit too much. So I use this both in my car and on airplanes and all of that stuff. So very much in the same way. So I'm just going to flip around so you can see. So if I'm sitting up against a chair, I'll find that ASIS, go once to the outside an inch and down an inch, and I'll just push it against the back of the chair and through this area, and I'll massage this area out. I'll very often put it against my piriformis in the back of the chair and massage that area out. And of course, my hamstring is pretty easy to do in a sitting position. So I'll just put it right where my leg meets my buttocks and I'll sit with it. So I've been known to drive in the car.
If I'm driving and then she'll be using it in the passenger seat.
Yeah, so I can use it like that, and I can also use if I get into a piriformis stretch, which many of you have seen, if I'm not driving, of course, I can also put this on my piriformis at the same time that I'm driving. Again, I'll leave it there for about 3 minutes, and then I'll move it around. So we love these acuballs. We're going to show you in a couple other videos how to use it for other areas of your body. If you have any questions about them, let us know. I'll put the link below in case you want to pick one up. And other than that, if you found value in this video, please let us know by pressing like and subscribing. And we'll see you all soon.